Magandang araw Pilipinas, magandang araw Soccsksargen, and welcome sa isa na naman pong edisyon ng ating programang Performing and Informing at PIA 12 Infoline. Hatid sa inyo ng Philippine Information Agency Region 12 at ng Information Coordinating Network of Soccsksargen o Icon Socs. Sa ngalan po ng aming Regional Head, Frian E. Abquilan, at ng aking partner sa technical side na si Oliver Ross Rivera, ako po si Aida de la Cruz agad at samahan ninyo kaming alamin ang mga latest development programs, projects, and activities ng ating pamahalaan dito po sa ating rehiyon dito sa Soccsksargen Region. Tayo po ay mapapakinggan sa ating mga partner radio stations dito po sa buong Soccsksargen Region and mapapanood po sa aming Facebook pages at sa YouTube and Spotify po. And today, pag-uusapan po natin itong isang napakalaking institusyon na nagbibigay serbisyo po para sa kalusugan po ng ating mga mamamayan dito po sa Soccsksargen Region. Ito pong Soccsksargen General Hospital. And we have with us today ang Chief of Hospital po, si Dr. Ceril Magbanua-Borromeo. Doc, good morning and thank you. Pinaunlakan nyo ang aming imbitasyon na maging guest dito po sa aming programang Performing and Informing. But before that, Doc, bumati naman po muna kayo sa ating mga listeners and viewers.
First of all, I would like to greet everyone, particularly the staff of the Philippine Information Agency. And I would like to take this chance to thank Ma'am Aida for accepting us today, for giving us the slot for this time, for this interview. And I will take also the chance to greet everyone happy holidays and to
Yes.
all listeners of PIA and all the stations that are included in this interview. Again, good morning everyone.
Okay, Doc, bilang panimula, can you give us updates on the operations of the Soccsksargen General Hospital o itong SGH?
Okay. Thank you, Aida, for that question. So, Soccsksargen General Hospital, so we all know that it is located in Barangay Dahay, Surala, South Cotabato. Presently, we are a level 1 75-bed capacity institution. So, meaning to say, we cater a lot of services as a level 1 institution. So, for the services we offer, we have the emergency medicine department.
Okay.
So, ano bang emergency department? So, we cater emergency cases. So, first, patients are brought to this area, for emergent needs. Then, we also have the outpatient department. For the outpatient department, we are open from 8 o'clock in the morning until 5 in the afternoon. So when you say outpatient, consultations lang po sila, but those who are needed admissions, they are referred to the emergency room. So for our outpatient department, since we have started our operation in August 15 of 2022, we are barely 1 year and 4 months old institution. So we cater an average of 80 to 100 patients per day in our outpatient. So for our outpatient, we accept cases coming from the different municipalities, particularly in the Upper Valley community. So aside from the consultation, we also offer services as Animal Bite Center. So we have the ABTC. We just recently opened it last November of 2023. We also have yung ating public health unit. The public health unit. So ang ating public health unit, it is mandated under the universal health care. So we have just launched our public health unit last August of this year. I do hope you have attended this event in our institution. So if you asked about public health unit, ano ba itong public health unit of our outpatient department?
All right.
So this is to support the implementation of the national health programs of the Department of Health. So meaning to say, because the Department of Health has a lot of health programs included in their calendar year, so we implement this program in our institution.
Okay.
And aside from that, the PHU needs to institutionalize the primary healthcare provider.
All
So,
right.
yun siya, no? And again, PHU is a one-stop shop patient navigation mechanism in our institution. So, it is based on the universal healthcare. So, bali ito yung networking or the healthcare provider network. So, meaning to say, we accept referrals coming from the different barangay health
Okay.
units or the LGUs, and then they are referred to us that needs primary care of treatment. But cases that needs higher intervention, they are referred to a level 2 or level 3 hospitals. So I mentioned about this PHU because the public health unit encompasses our HEPO or health education and promotion, no,
Okay.
officers.
Yeah.
So sila yung in charge of our different programs in the hospitals. So ang dami kasing program. It is monthly. Monthly, Ma'am Aida, no?
Oh, yes,
Siguro naman
Doc.
aware na kayo dyan. Ang dami-dami nating programa. But as of now, we are more focusing on marami tayong sa adolescent programs.
Okay.
Yung ating teenage pregnancies, the AIDS, yung mga smoking programs natin. We also have our Cancer Prevention Month.
Okay.
We have the deworming for the kids. So we have the Oral Health Month in February. So the lifestyle diseases, the hypertension, diabetes mellitus, and the like, no? Ang dami-daming yan. And again, also for our outpatient department, we have the wellness program. We
Okay.
have also the HIV screening, no? Screening. So
Free yan, Doc?
Yes, it is free. So we screen, siyempre, first our staff and our ating mga clients, no, that wants to be screened because hindi naman kasi mandatory ang screening, it is voluntary. So based sa ating legal mandate, no. So meron din tayong mga continuity clinic for the newborn screening.
Okay.
So if you want to ask what is continuity clinic,
Yeah,
because one of our programs that is daily done is the newborn screening.
Okay.
So all babies delivered in our institution are screened. So yun ang newborn screening. They are screened for metabolic disorders
Okay.
24 hours after they are given milk, no, breastfeed. So those babies that turned out to have positive cases. So ano ba itong mga sakit na ini-screen natin sa newborn screening? So most common are the congenital hypothyroidism, no, the congenital adrenal hyperplasia, mga
Okay.
ganun siya. So we have also mga blood disorders because a total of 28 disorders are now being screened. No, we have PKU or phenylketonuria, meron tayong mga galactosemia. So, ang dami sa list, no? So, cases who undergone newborn screening and turned out to have positive, no, sa mga cases.
Okay.
So, any one of the diseases, they are now enrolled in the newborn screening continuity clinic. So, it is based in our outpatient department. So, yung mga cases na yon, so they are treated immediately. For the purpose of this treatment is to save life.
Okay.
Because these
Yes,
disorders, hindi natin ma-detect at birth. Because babies look normal at birth, pero hindi natin alam may mga sakit pala sila. So through this newborn screening, madidetect natin early to save them from death and the other effect is the mental retardation.
Yes,
So once positive na sila, Ma'am Aida, we are starting their medication. It is given free by the newborn screening center in
Ng
Manila.
SGH about.
Oo, meron kami ang one of the continuity clinics,
Okay.
but we are supported by the newborn screening center in Manila. Ganun siya, ma'am.
Doc, halimbawa mga emergency cases na hindi residents ng South Cotabato, kinikater ba ng SGH?
Sure.
Walang pinipili ang
Walang
SGH.
pinipili. Kahit saang lupalop ng Pilipinas, pwede kayong pumunta sa SGH for an emergency cases. And to tell you, ma'am, because we are situated in the Upper Valley community, majority of our cases are coming from, siyempre, Surala.
Yes.
Because nasa Surala kami. Approximately 43% of our cases are coming from the residents of Surala. And second to this are coming from Banga. So, few ano lang kami, kilometers away from Banga. So, approximately 30% of our cases came from Banga. And the rest, mga approximately 17% from Tiboli and Lake Cebu. We also have cases coming from here, from Coronadal. We also have from Tampakan, ganon, from Norala, from Santo Niño. Although, meron naman tayong Norala District Hospital, kaya few of our cases are coming from the areas of Santo Niño and Norala kasi mas nearer sila sa Norala District Hospital. So, yun po ang aming mga kinikater na patients. But as you have said, Ma'am Aida, we can accept anybody.
Yes.
Okay.
Walang pinipili ang SGH.
Walang pinipili.
Doc, regarding naman po sa payment ng mga hospital bills, pwede ba silang mag-avail nitong NBB? No.
Yes, kasi sa the Universal Healthcare Act, which is 11223, so this is all about all Filipinos should have access to quality healthcare services without financial hardship. So yun talaga ang inaano natin ng universal healthcare. So the word without financial hardship, meaning hindi sila magbabayad. Because recently we have heard na sumisingil daw ang SGH. So I really want to clear this issue because we have the MAIP, the program of the MAIP, yung medical assistance for indigent patients. So, ano ito ibig sabihin, ma'am? So, all of our cases admitted in our institution, may mga PhilHealth yan sila, no?
Yes.
So, siyempre may package ang PhilHealth, may specific amount for certain diseases. So, yung excess of the package of the PhilHealth is covered by our MAIP. Or for the MAIP.
Mga indigents.
By the indigents. Kahit nga hindi indigent, ma'am, binibigyan natin yan kasi we are a government institution.
Yes.
So, but there are, from January to November, so we have already catered 9,400 plus cases that availed our MAIP. And approximately 68% of them are nabigyan. So, I know you will ask, how about the remaining 32%? Anong nangyari sa kanila? Because hindi lahat nabibigyan na MAIP for the following reasons. Ang iba kasi, because before we give the MAIP, kasi sini-check yan.
Yes.
We are documented it because pera po yan, ma'am.
Ng gobyerno.
Ng gobyerno. So, for the past 11 months, we have given more than 34 million for our MAIP, for our indigent patients. So, as what I have said, ano ang nangyari sa remaining 32%?
Okay.
Some of the patients who were initially admitted in our institution were transferred to other hospital. So, kasi especially those who needs more specialized care, referred to a level 3 or level 2 institutions. So, ang nangyayari kasi, because ang sa PhilHealth, once you are admitted in the first hospital, then ita-transfer ka to the second hospital. Hindi mo gagamitin yung iyong PhilHealth package sa initial hospital. Doon siya magagamit sa second hospital.
Okay.
So, I know you will ask, paano ang bill nila? Kasi na-transfer sila. So, in these cases, we use our QFS, Quantified Free Service. What is QFS? So, aside from yung nag-transfer, may mga cases tayo, especially coming from the GIDA, geographically isolated and disadvantaged areas, malayo sila, they don't have an identification card. So, wala silang ID, So, requirement kasi, ma'am, before giving the MAIP, kasi meron kaming assessment tool, so dapat indigent sila, so they have to present their ID. So, iba wala kasing ID. So, they do not comply with the requirement, so hindi sila nakakapasok sa ating MAIP na program. So, yun din ang isa binibigyan namin ng quantified free service.
Okay.
And another reason is, ang MAIP kasi are given to patients, for example, ngayon, so dapat 3 months yan or 90 days. Dapat, after 90 days, pwede kayo ulit mabigyan. Hindi pwedeng na-admit ka ngayon, next month na-admit ka, kung hingi ka naman ng MAIP the following week,
Yes.
MAIP. Kasi we prioritize, i-share naman natin sa
Yeah.
iba.
Oo.
So just like in PhilHealth, di ba ma'am?
Yes.
Kapag nagkasakit ka ngayon ng pneumonia, after a month, yun pa din ang same diagnosis, hindi siya magagamit.
Yeah.
O hindi siya, babayaran mo na siya, or dapat ibang sakit na naman. So, just like sa usage ng MAIP natin, so dapat more than 90 days na yung pag-provide natin ng MAIP ng assistance sa inyo.
Okay.
If less than, hindi natin siya magagamit. So, yung 3 common reasons na hindi natin maibigyan ng MAIP, ayon, transfer to other institution,
Okay.
lack of requirements, and then less than 90 days ang kanilang confinement. So, for these situations, we use the quantified free service. So, what is QFS? So, alam ko Ma'am Aida, ano yan? Ano yung QFS? Ang QFS is our money. Ang
Okay.
income ang
SGH.
funds ng SGH. Yun ang itapal doon sa kulang ng payment ng ating
mga patients,
Oo. So, kami mismo, kami din nagbabayad sa aming bill. Parang ganun siya.
Okay.
Doon siya, that is approximately 32%. Kasi
Okay.
68% are given the MAIP. But there are times talaga na gastos din sila, especially kasi alam niyo naman, government tayo, maraming requirements.
Yes,
So,
oo.
ang iba kasi, ayun, ang dami-daming requirements,
Oo.
ganun. Binabayaran na lang nila because siguro able naman sila to pay. So, ganun. Ang iba naman, nagbabayad din, ma'am. So, this will be our source of additional income.
At least makatulong dun sa mga indigents talaga, Doc.
Oo, so dapat talagang indigent ang bibigyan natin ng ating assistance program. Then with that, I would like also to announce that our Malasakit Center
Yes, yun ang
is
gusto ko
soon
sana
to be
tanungin,
launched.
Doc.
O, sige. Okay, ma'am.
Oo.
If
Sige,
you
Doc.
want
Go ahead po.
further,
Yes, go ahead, Doc.
questions about the Malasakit
Oo.
Center. Actually, we have already built, in just beside our outpatient department
Okay.
is our Malasakit Center. So we are now ready for launching. Waiting na lang for the central office, particularly with our Honorable Bongo and the staff of the Malasakit Center,
Okay.
and to visit us for the launching. So we are just waiting for them. So Malasakit Center is in cooperation with other agencies. The first of all, the Department of Health, the
Yes,
PhilHealth, DSWD, and the PCSO. They will be providing their staff from DSWD, PhilHealth, and PCSO for the DOH sa amin na yon na
Okay.
staff. So yan siya, collaboration niya ng 4 agencies. So, kanina we are talking about the MAIP that is given to us, to help our indigent patients. Once we open our Malasakit Center, we can give more assistance to our patients, especially those who are indigent.
Sana malapit na ito, Doc. Ano?
Oo nga, we are waiting nga. Akala ko nga nung last month. Kaya minadali po namin, Ma'am Aida, because nasa number 1 po kami sa list na
Wow.
pupuntahan. But we were informed na ano daw yan, iisahin lang nila. Kung may pupuntahan sila dito sa mga, alam ko you have heard about super health centers.
Yes,
Under din yan sa kanila eh. Kung meron silang ila-launch or opening of the super health center within the locality of the Soccsksargen, pupuntahan na nila kami. So, talagang you will be invited, Ma'am Aida, in this important occasion soon.
Oo.
Sana before mag-end ang year,
Yes,
no?
oo. Doc, for the past 11 months,
Yes.
mga anong mga special cases ng mga sickness, illnesses
Okay.
ang na-serve ng SGH?
So, you mean to say what are the leading causes
Yes,
of mga cases natin? So, nationwide, first, the leading cause of mga sakit is pneumonia.
Okay.
Both adult and kids. So, yan ang in all institutions, pneumonia kasi is very common, no? Yung mga ubo na yan, no? So, meron pa nga tayong walking pneumonia ngayon,
Yes,
no?
Dok. Yun
Oo.
Sana
Actually,
hindi naman.
walking pneumonia is a mild form of pneumonia, which is
Okay.
caused by Mycoplasma pneumonia, that is the organism. So, kaya nga the word walking, it is not a medical term, no? Yun lang
Okay.
description nila. Walking pneumonia because it is a mild form. Fever, cough,
Okay.
dry cough, yung headache, body malaise or masakit ang
Oh.
katawan,
Pero not
weakness.
as deadly as
Hindi siya that severe kasi walking, meaning to say yung taong may walking pneumonia naglalakad siya.
Yes.
He
Oo.
can go to work, he can go to school, kaya siya walking, but it can lead into a serious din na illness. Kaya ganun siya, pero wala pa naman silang proven na case dito sa atin sa Philippines.
Okay.
Pero syempre we are ready for that because we need to identify the organism. And then Ma'am Aida, the second cause of morbidity or illnesses is acute gastroenteritis. Ano yung
Okay.
acute gastroenteritis? Yung tae-tae, no? Suka-tae. Usually it is caused by a viral infection, no? So usually it is rotavirus. So acute gastroenteritis po,
Okay.
karamihan. Especially, di ba, just before we had din mga cases of diarrhea, we have an epidemic, no? It was
Yeah.
last October of 2022. Kaya lang, naging cholera po yun, no? It was, na-confirm namin sa RITM because
Okay.
recent yun. So, but the most common is the viral gastroenteritis, especially among children who were not
Okay.
given the rotavirus during the first 6 months of life. So, dapat meron. Kaya lang, unfortunately, it's not available in barangay health centers. So, available po yaman sa mga private practicing pediatricians. So, that's
Okay.
the second. And the third is, kasi tinotal namin yung all cases, the third is acute gastritis. What is
Okay.
acute gastritis? So, nag-encompass din yan siya ng mga peptic ulcer disease, yung mga sakit sa kuto-kuto, yeah? Mga ulcer, yung mga tinatawag lang hyperacidity. So, marami kasi, no? Ngayon, mga adolescent, no, kids, ang dami. Why? Because ang daming nabibiling pagkain, no,
Yes.
fast food.
Sa ating mga
So,
pagkain.
oo, hindi pa nakakain ng breakfast, nandoon na sila sa mga drinks. Ewan ko, ano ba yan? Hindi ako familiar.
Lifestyle.
Mga lifestyle disease, may mga tea. O,
Oo.
naglinago para mga kabute itong mga coffee shop, mga, ano ba yan, tea shop, o, di ba?
Oo. Yeah.
Mga tea, I don't want to mention, no? Basta marami. So, ang mga bata kasi, even adults, nakikita ko sa office, may nakapatong na may tea,
Milk
may
tea.
coffee, milk tea, coffee, o sige. So, it causes sa mga ganon. And hindi na kasi sila proper ang kanilang diet. So,
Yeah.
nagpangatlo na siya, ma'am. No? That's the... Number 4 is, baka magulat kayo, it's dengue fever.
Okay.
Yes, dengue. So, dengue fever is very common. So, from the start na nagkaroon ng dengue fever, siguro way back 19, because the first case we have handled before is way back severe case in 1988, no? So, since then, dumami na ng dumami. Alam naman ninyo is, mosquito-borne
Yes,
ang dengue. Kaya anywhere may lamok. So, parang hindi na siya seasonal eh. So, nagiging all throughout the year, marami na tayong dengue. But it is very important, especially among children. Hindi din spared ang adult because we have a
Yeah.
lot of cases na ang mga adult nag-dengue din sila. But I would like to point out what dengue fever is for everyone to know. Dengue fever is talagang high grade. Remember my fever, ha? Pag walang lagnat, hindi siya dengue fever.
Okay.
So, usually, ma'am, 2 to 5 days, high-grade fever. Tandaan natin, high-grade, 39 to 40, even 41 degrees centigrade.
Yeah.
And then, mapansin nyo yan, ha? Kahit bigyan nyo sila ng gamot na paracetamol or antipyretic, hindi bumababa sa normal ang kanilang lagnat. And it is coupled by vomiting,
Okay.
abdominal pain, loss of appetite, body weakness, luya ang patient. And one thing na makita kami, because I'm a practicing pediatrician for several decades now, makita mo lang ang patient, itsura niya, dengue na yan. Why?
Okay.
Ang isa kasi na talagang parang pathognomonic na physical finding ninyo is flaccid ang mukha nila, namumula. Para bang
Okay.
galing siya sa, naligo ka sa dagat, parang sunburn.
Mm.
So yun talaga, ma'am, if you look into the patient, pulang-pula ang face, namumula ang kanilang mga tenga, ang mga palms nila. For the rashes, siguro, minsan kasi nami-mislead ang mga natin for the rashes. the rashes kasi it will appear during the recovery period. Yung tinatawag naming Herman's rash.
Okay.
Yung tinatawag na mga rashes, yung mga maculopapular, mga other viral illnesses, hindi yan siya. So, or may makita tayong petechial rashes, yung mga talagang mababa na ang platelet count nila. But the most important here is pag mataas masyado ang lagnat ng ating mga patients, consult a physician para hindi tayo maalala.
Yes.
And the fifth cause is urinary tract infection. Yan,
UTI.
UTI.
Oo.
Yes, UTI. And the sixth is hypertension, lifestyle diseases. We
Para
have
sa
hypertension.
Mga may age na. Age.
Oo, pero maraming hypertensive ngayon na bata pa.
Okay.
Even kids, pwedeng may hypertension if they have
Bakit ganun, Doc?
renal diseases naman. Acute glomerulonephritis. Yan ang nagpakukos ng hypertension.
Okay.
And then may mga tumors. Tumor of the brain, may hypertension. But majority, kaya pag 40 and above tayo, make sure meron na tayong annual physical examination para to detect early. So, hypertension. And then the next is intestinal amoebiasis. What is intestinal amoebiasis? Sabi nila, Doc, kapag ba may amoeba ako, lifetime na ako. Hindi. If you are not treated well, hindi complete ang treatment mo, talagang meron yan, babalik at babalik din siya. Kasi nandyan pa, no? Kasi may stages naman ng amoeba, so matagal. So the next is the diabetes mellitus. Diabetes and hypertension, one of the lifestyle illnesses which is very common, di ba? Sa ngayon kasi, pag nagsasama na mga seniors, just like me, ano ang maintenance mo? Kagabi, we just had our Christmas party with our buds during high school. So, most of us are 63, 64, and some of them are 65 na. So, nagtatanungan. So, nakakatuwa nga, Ma'am Aidse. Every time may reunion kami or may mga gatherings, lahat nakapila. Pareseta ako gamot. Kasi mga senior citizens na. Okay, so, yun po ang mga leading causes natin so far in our institution. So, ang dami naming cases doon na handle.
Oo. At least napaghahandaan ito ng SGH na makater yung mga problems na ganito, Doc. Ano?
Yes, because for our other ancillary services, we have the laboratory, no? We also have already our blood station. So, ang ating laboratory have all the basic laboratory procedures, the clinical chemistries, no? Meron na kami niyan. So, eventually, we will be having our tertiary laboratory. So, ongoing ang aming construction for the expansion of our laboratory for us to have a bacteriology and histopathology.
Doc, how about yung cancer, Doc? Maka-cater din pa ng SGH?
So far, ang cancer kasi is subspecialized na yan na field, but we have surgeon, no? And also have OB-GYN specialist because cancer, most common is female is the breast cancer, no?
Okay.
Then lung cancer, we have a adult pulmonologist also in our institution. So, we can detect. But for the treatment, referral na po yan sa mga special, level 3, specialized care na services. Kasi ma'am, cancer na siya. So, we refer it either to the CRMC, to SPMC, or to DRMC in Tagum City for the management. But we have the programs for the cancer prevention. We do lectures for the information dissemination of the public to be aware of what cancer really is.
Doc, may we know yung mga future plans po ng SGH?
Okay, for the future plans, because ang aming vision is to be an Apex Premier Hospital by 2034. Oh, at tagal pa.
Grabing preparation.
We have done our 5-year development plan through the Health Facilities Development Bureau. So, ang dami naming plans. Because as of now, we have ongoing construction with the Pentagon area. Yan, Ma'am Aids, yung Pentagon is the dating Upper Valley Community Hospital.
Okay.
But another building was built at the back. Oh, the
Yung design niya,
two-story.
pentagon talaga, Doc.
Oo, pentagon, 5 sides,
Okay.
5 ba? Okay, o, pentagon
Oh,
talaga siya, ang
yes.
ganda nun, no? And then, ongoing renovation na siya ngayon. So, at the back is the two-story building, the nursing building, which we are now using, no?
Okay.
Nandiyan lahat ang ating emergency. But later, we will be transferring by January, pag natapos na ating, So, by January, our emergency room will be transferred to the front building or the Pentagon area, as well as the admin, yung mga offices. Andoon na yan siya, ma'am. So, as I have said, under construction na din ang ating laboratory. So, beside the laboratory is our radiology or the
Okay.
imaging department. O nga pala, ma'am. So, I want to elaborate our imaging department,
Yes po.
or we have, siyempre, meron kaming x-rays. We have the ultrasound. We also have the CT scan, which we just launched last October 4 of this year.
Okay.
For our CT scan, we only cater as of now inpatients. Why? Bakit inpatients lang muna? Because limited pa po, especially our staff. Because when you do a CT scan, sometimes kailangan talaga yan ng may dye, no?
Yeah.
Meron kaming meron namang plain lang, but yung need ng may dye, we need an additional staff to handle. Kasi ang dami naming cases for x-rays, for ultrasound, hindi makaya ng aming staff. But eventually, I do hope next year, because we are aiming to be a level 2
Yes.
institution for the next, I do hope, 2024. Because as for a level 2, we need to have an intensive care unit. It's now ongoing construction, soon to be finished by January 6, kasi ang ating contractor natin, January 6. So, we will be having a tertiary level of laboratory. Yan po ang requirement, ma'am. So, I do hope by that time, madadagdagan na ang aming manpower. Because as of now, with the 75-bed capacity, we are only complemented with 144. That is aligned with a 50-bed capacity. But recently, we were approved by the DBM, nag-additional na sila ng 21 additional plantilla positions that is ongoing ang aming ngayong hiring. So, ang daming applicants, no? Ang dami ng applicants, but it's only 21, no? 8 doctors, 6 nurses. Ilan na 'yun? 8 plus 6, 14, and 7 admin. So, yun siya, ma'am. So, tingin ko kulang pa rin, because with the 75-bed capacity, we are catering an average of 120 to 130 admitted patients per day. So, overbed po kami, ma'am. So, overbed kami. So, pasalamat kami because we were given by NKTI namang beds, no? Nag-donate sila. So, we have used it despite na binigyan kami ng 54 beds, kulang pa din because it is doubled. So, ang dami naming patients sa ngayon. And another problem is yung ating mga doctors kulang pa din, especially the subspecialists. As much as we wanted to have more subspecialists, kaya lamang wala na kaming plantilla position. So I'm telling them, wait for the approval of the DBM for us to be a level 2, kasi kailangan talaga bang may Republic Act yan siya coming from the Congress. So hindi sila pwedeng magbigay sa atin ng budget without that.
Doc, ang sarap sana ng usapan natin.
Oo nga, no? Parang kulang, no?
Kulang ang 30
sige, ang
minutes.
dami-dami dapat malaman.
But before we end, Doc, mga announcements, mga final words niyo po.
Okay, so to end this topic, no, I would like to inform each and everyone, so sa ating community, no, particularly along the Upper Valley community and the rest of the Soccsksargen region. So, SGH is open to everyone. So, open kami. So, with regards to, sabi nating payments, we are offering our MAIP. Meron po tayong pera for that. So, I do hope, kasi hindi natin maiwasan, no, sa social media, there are some negative, no? But our information officer, at my side, si Ma'am Grace Becerra Quintero.
Masipag yung IO.
Oo, ang sipag-sipag nito. I will, sinabi ko na dito ang name mo, Grace, ha? Oo, whatever concerns, whatever mga complaints nila, it will be answered on time. So, lahat naman po. So, we accept mga comments, negative or positive, because this is
Yes.
our way for us to improve our services. So again, we thank you everyone. So even those who are complaining, no, so we will give chance to improve our services and for the next months or years to come. So I do hope we can continually give our quality services to all our customers, both internal and external.
Okay, let's hope for the best for SGH, Doc. No?
Thank you, Ma'am Aida.
Thank you very much, Doc, and thank you rin sa ating masipag na information officer po ng Soccsksargen General Hospital. Again, maraming salamat, Dr. Ceril Magbanua-Borromeo. Thank you very much.
Thank you
Doc.
again, Ma'am Aida, and good morning.
Okay. Sa ngalan po ng aming regional head, Brian E. Abquilan, at ng aking partner dito sa technical side, isa na naman pong edisyon ng aming programang Performing and Informing at PIA 12 Infoline ang aming hatid sa inyo ngayong linggo. Marami pong salamat sa inyong pakikinig hanggang sa susunod na linggo po. Muli po, ako po si Aida de la Cruz Agad. Magandang araw, Soccsksargen.